Minnesota is the 23rd state to legalize recreational cannabis. However, you will not be able to buy it from retail stores for up to 1 year.
And of course, there are plenty of questions surrounding the relationship between pot and your health. Devon Rahming did some digging for us.
There you go.
With the legalization of marijuana now signed into law in Minnesota, what this means for public health is still to be determined.
There are some weak short-term studies.
According to Dr. Alta DeRue,
Yeah.
Chief Medical Officer with the Hazelden Betty Ford Foundation, there are only 2 approved marijuana-based medications for medical use.
They are dronabinol and Epidiolex, and both of those treat seizures.
While some may use the legalization of recreational marijuana to help manage ailments at home,
It can help out with some pain symptoms.
it's the opportunity for easier access that doctors say may present issues for certain age groups.
Just the fact that it's going to be legalized for recreational use is going to be perceived by youth as it being less risky, much like alcohol.
Which doctors say negatively impacts brain development.
It affects the prefrontal cortex, the front of the brain. That's the last thing to develop. And the youth or the adolescents that get involved with marijuana will have an issue with that decision making and executive function.
And it's not just teens.
For those few who have pre-existing mental health issues, or for pregnant persons, or for the youth, this is a risky road to go down.
Knowing there's still more to be determined.
I think that once we go down the road of normalizing a drug for people to use, that we need to also compensate for that gap in the public health that we may be missing.
Now, doctors are pushing for more mental health resources and funding for the treatment of substance abuse disorders. And leaders at Hazelden Betty Ford will host a community conversation in 2 weeks addressing the use of marijuana and public health. Randy.
All right, Devon, thank you.